next year. So I think this is a great opportunity to hear Robert's journey into his research, and I'm looking forward to co-facilitating this session. I think this is an excellent initiative of FiND, and we're looking forward to the presentation today.
All right, thank you very much, Irene. Okay, so for our first resource speaker, our inaugural resource speaker for the webinar series, we'll have a good friend from Nanyang Technological University. He is a research fellow from the Center for Healthy and Sustainable Cities. He just completed his PhD in communication science at the famous Wee Kim Wee School of Communication and Information. His research examines ICT adoption, particularly on smartphones, social media, and location-based advertising, including its predictors, outcomes, and processes in healthcare and non-healthcare contexts. He received his master's in public health at the University of the Philippines, if I'm right. And a registered nurse in the Philippines. He has published a number of articles in top-tier journals such as Computers in Human Behavior, Cyber Psychology, Behavior, and Social Networking, Health Communication, International Journal of Medical Informatics, Journal of Health Communication, Journal of the American Medical Informatics Association, and Nursing Outlook. Please help me welcome Dr. John Robert Bautista. Magandang umaga sa'yo, John Robert.
Yeah, thank you very much. I'm honored to be part of the first inaugural webinar series for FiND as a presentation. So I think everyone is able to look at my PowerPoint slides. My presentation is about nurses' use of smartphones for work purposes in the Philippines. Okay. This topic was born out of an increasing literature on the use of smartphones for work purposes. Okay. So just an overview. This presentation is somewhat a synthesis of different research outputs. This presentation is actually my thesis. It's practically my thesis, but because of the amount of data collected for the thesis, there's no way that it is somewhat reflected in one journal article. So I have been publishing my portions of my thesis since 2016, which I completed in 2019. So slowly, 2016 and 2019, and for now, there's still some portions of my results that are still under review. So I think what's one way to actually drive yourself to be somewhat productive is as early as you have any data that you have, like preliminary data, you can start to work with those data to publish something out of it. So someone to actually write the thesis in itself, and eventually this would help you to somewhat get reviews from outsiders so that this would eventually help the thesis in itself. Nonetheless, all copies of my journal articles are available in my website. The link is in below. So you can just search my name and my website will pop up on Google search. So my presentation will have 5 portions. I'll start with a background of what the research is all about, and I'll share with you some of the research questions that I proposed on my research, and I'll discuss a bit on my theoretical framework. Well, this is a PhD work, so a theoretical framework is somewhat of a great importance. And next are the results. And lastly are some policy suggestions that came out of this research. Okay, so let me start first with the background. As we all know, every one of us have their own smartphones. It's almost this device is ubiquitous. You'll be surprised if someone doesn't have a smartphone. Okay, so smartphone is not a predictor of whether you're rich or poor, whether you're from a lower economic status or higher economic status. One would be able to afford a smartphone right now, regardless of they're in the developing or developed world. So our smartphones are used first. We use it for personal reasons, communicate with loved ones, send instant messages to people that are like friends. What use different mobile apps to for entertainment purposes. But along the way, because the smartphone is a portable device, this is something that we can carry on work at work, and in some cases, there's a spillover effect. So there's sometimes that you can actually use your smartphone for personal reasons during work, and vice versa. You can actually use your smartphone even you're in a personal setting for work purposes. So it enables mobile communication regardless whether it's for personal use or for work purposes. Um, the focus of this research would be more on the work purposes. Okay, so that's the general context of the research. So most of this study is came about after realizing the impact of smartphones into the work of different people. So if you would read research, if you would look at literature, there have been much studies on like how mobile phones are used by fishermen, by farmers to go about their work, and those are some of the um, that is one industry. And there's also research on how this device is used by IT workers and different office workers. But there are bit of literature that how healthcare professionals use it. Okay, so moving onwards, why smart? Why I'm interested with smartphones, nurses, and the Philippines. As you can see, if you type on Google smartphones and nurses, one of the article that pops out is that is smartphone usage in clinical work an evolution or a revolution? So Cheryl Parker wrote in that article that it revolutionized clinical work for nurses. What she means is that at least in the U.S. or in most in some developed countries, nurses often need to use legacy devices like pagers, landline telephones, and somewhat with the introduction of smartphones, it's able to really revolutionize how nurses communicate with the healthcare team. Smartphones are not only communication devices, they're also information devices wherein you can use it to connect to the internet to actually search for information. So this one simple device actually integrates almost several devices. It integrates a landline telephone, it integrates a desktop computer, it integrates your camera all at the same time. So the possibilities for its use for clinical work is something that can is it's not that endless, but there's are several ways to actually up this device for actual clinical work. Next is that there's this phenomenon that we call IT consumerization. When you hear the word IT consumerization, it basically means that personal devices are being used by employees to facilitate organizational work. So the concept here is that back then, technologies are usually provided by organizations to employees. So that's the flow. So the organization provides the technology to the employees. One example, desktop computers. Once you start your work, your organization actually assigns you a desktop computer that you can use for work. Without that desktop computer, it's quite impossible for you to actually do your work unless you have your own laptop to use. Now, when you actually use your own laptop to facilitate work, that is what we call IT consumerization. So the organization actually relies on the employee using their own devices. Now, with the introduction of smartphones, organizations do not usually provide smartphones to their own employees, but employees heavily rely on their smartphones for work purposes. Whether it's for personal or for work, they actually use it because it's already there. That is something portable that they can actually use. So that is an interesting concept now in information research, which is what we call the IT consumerization. So that's something of a concept that is interesting to take note in organizational research. Next, why nurses? Um, Much of the literature are in medical doctors' use of smartphones, especially the use of WhatsApp and different instant messaging for interprofessional communication. But if you would imagine, like, it's quite weird that there's less research on this topic, despite that the nurses are the largest group of healthcare providers in hospitals. So that is something to take note. And because nursing in itself is a communication and information intensive work, we don't just communicate among nurses, we communicate with practically the whole healthcare team, regardless of what profession, what clinical background that person has. So we need okay. So there's an important concept here that it's really interesting how nurses actually use their own smartphones for work purposes. Next is that why the Philippines? As you can see in the picture, this is a typical clinical scenario in the Philippines. And this is a typical ward. Presumably, this is a government ward in the Philippines. So you can feel that the number of patients are more than the nurses who are being on site there, and we don't even know whether those nurses are regular employees. Some of them might be volunteers who don't receive any pay at all. Nonetheless, if you can see the female on the right, towards the extreme right, you can see that she's like nodding and holding something with her hand. So this is a typical scenario in the Philippines, and don't expect that the government hospital would give you a smartphone or what we call, or in some cases, a non-smartphone. In literature, a non-smartphone is defined two ways. One is a worse way to define it, and one is a much more politically correct. One way is to say it's a dumb phone, no camera, just used for call and text, or at least in literature, they would usually call this as a feature phone. Why the Philippines? There are less studies in developing countries, and despite of that, almost more than half of the people would have their own smartphones. And basically, most hospitals in the Philippines have underdeveloped health information technology. We don't even have a practically useful electronic health record for most of the clinical sites that we have, and there are more patients than nurses. And the more patients that you have, the more things that you need to communicate with healthcare providers, the more technology that you need to use for communicating that. And that's where the smartphones actually comes into play. So to set the context, I'm looking at the use of smartphones for work purposes during working hours in a hospital setting. So when I did research, I do recognize that it can actually be used that, for example, after a nurse ends her shift, she can actually be out of the hospital, but she can still continue to actually communicate with colleagues just in case that there's any problem with the endorsement and during clinical handover. But this research is limited to the point that it's used for during working hours in a hospital setting. Primarily, I did research on tertiary level general hospitals in the Philippines. So, for example, the likes of the Philippine Heart Center, Lung Center, those are excluded because they're not general hospitals. They're more of a specialty hospitals. So, why do I do this research? First is to actually contribute to literature. I mean, for any PhD topic, you want to contribute knowledge. So I need to contribute to a certain portion of the main knowledge, which is on the use of smartphones, especially for clinical workers and among clinical workers, nurses. I want to provide a theoretical point of view. So from a theoretical, and provide any theory and evidence-based policy suggestions towards the end. So in terms of my research questions, I'd like to know what factors actually predict their use of the smartphone and what are some of the outcomes. I answered them using in-depth interviews as a preliminary way of doing things. And I did conduct surveys, so I'll share more of those later. The third question is actually, what are some of the organizational issues associated with it? So for that, I actually use focus groups to understand these issues in depth. So my research is composed of 3 data collection periods: an exploratory study, a study 1, and study 2. This in itself is my thesis. So it's a 3-part research. So it's started from a qualitative portion to quantitative and another qualitative. So this is more of a sequential mixed method research. So to be more specific, it is an explanatory sequential mixed method research. So I'll be sharing with you more specifically of the results and the methods in the next portion. Now, so in summary, I want to know the predictors, outcomes of use, as well as the issues related to it. So in terms of the theoretical framework, I use 3 theories from communication research, from information science research, and from organizational research. The first theory is the theory of planned behavior. So I like to know what are the behavioral antecedents of smartphone use for work purposes. So according to theory of planned behavior, it can be predicted by one's intention or willingness to perform a behavior, their attitude, their norms, and their control. Later, I'll focus on during the results, I'll explain some of this constructs. I also adopt from organizational support theory, wherein the use of technology would depend on whether the organization supports it. So I assume that I hypothesize that perceived organizational support, so staff nurses' perception whether their organization supports their use of smartphones or not, would affect some of these behavioral antecedents, attitude, norms, and control. That is for research question 1. For research question 2, I adopt IT consumerization theory, wherein I'd like to see this theory basically states that the use of personal devices for work can actually lead to positive outcomes, work outcomes. So I'd like to see whether the use of smartphones for work purposes is positively associated with perceptions of work productivity and perceptions of quality of care among nurses. So if the theory is based on the theory, it should somewhat have a positive relationship. So the more that you use it, the more that you feel that it gives you more work productivity and gives you much more perceived quality of care given to patients. So those are the outcomes. In terms of the issues, I try to look at how organizational issues actually influence perceived organizational support among staff nurses. So later on, I'll present the results of this research. Nonetheless, this is the framework that I use for my research. So it's informed by the theory of planned behavior, organizational support theory, and IT consumerization theory. Let's go over the results. For my exploratory study, which I did July 2015, so I interviewed 30 nurses. I mean, for me, when I'm conducting interviews, my minimum is always 30. Why 30? It's not because there's some interviews that you can actually do for 15 people, 20 people, but it makes it a bit okay for publishing. So somewhat, it's not a rule of thumb, but for me, it's a personal preference because this makes it less difficult to justify why you need to publish your work. So around 30 gives you the data saturation required for qualitative work, at least for some basic thematic analysis. So based on my research on the exploratory study, I want to gain a good understanding of this situation in the Philippines. And when I did the interview, I did have some preliminary questions, but the interview questions actually changed during the interview because of the insights shared by these nurses. Basically, the results shows here that nurses use their smartphones for three purposes. First is for communication purposes. Next is information seeking and documentation purposes. To share with you, for communication purposes, they use it to actually update members of the healthcare team, call and text. So you can see the usual routine and the routine when using smartphones. So it has a transformative effect. So, like for example, back then you need to inform them face to face, use the hospital's telephone or paging system. But now they're able to send text messages via SMS. If urgent, you can call that doctor using your smartphone. Sometimes nurses actually use instant messaging applications to send in text and images, to a certain extent, some videos, if needed. So that's for communication purposes. It's not only limited to healthcare colleagues, but also to patients. So that's a way to communicate with patients. Next is information seeking, to actually search via the internet, mobile applications, and PDF. So ebooks. So some nurses will have their own ebooks in their own smartphones. So for information seeking purposes. What is surprising with the research is that it's also used for documentation purposes. This is not a good practice, but it's a reality that happens. Document a patient outcome or incidents. So if a patient has a wound, you want to monitor the wound healing through the weeks. So some nurses take a picture of that, send to the doctor so that they can monitor the wound healing. Or the nurse takes a picture, sends that picture to a colleague, to a nurse for endorsement purposes. Some use it as an evidence that they take a picture of a patient's back showing that there's no bed sores, as a proof that then when they actually admit that patient, there were no bed sores. So it's like a legal protection for them. Well, this done with consent from the patient, but that is something that is a bit tricky in terms of privacy. Next is that what's surprising also is that they also take a picture of the patient's record because we don't have electronic health records, so it couldn't be shared with lots of people. There's only one physical chart, and that chart is often used by the doctor. What if the nurse needs to use it for executing some clinical work? So they take a picture of a portion of that patient's chart to be able to execute that work. So it's a bit tricky situation, but it's the reality that happens in clinical work. So that is the result of my exploratory study. Based on the results of this exploratory study, I was able to actually develop survey items. And I actually used it to conduct a survey. So one of my skills is begging hospitals to allow me to do research on their field, on their site. So I did research on 19 hospitals, like 5 government, 14 private hospitals. So I went to about this in total 19 hospitals, but I went to about 25, 26. So some of those hospitals actually reject me, which is okay. I mean, I understand their situation. So I did have my sampling framework in the image here, so to show you how I select those hospitals. So at the end, I was able to collect 534 staff nurses, but I only use about 517 because I realized that I'll just remove those that are non-smartphone users. So that was a turning point in my thesis. So instead of mobile phones, my thesis title actually changed to smartphones, to actually focus on the smartphones. Besides, there are very few that are non-smartphone users. So it was a valid reason for me to remove them from the data set. So I only have 517. So these are the ranking on how nurses actually use their smartphone for work purposes. So the survey items here were developed based on my preliminary study. So as you can see, The top 4 use of smartphones for work purposes are legacy mobile function. When I say legacy mobile function, there are just call and text. So text messaging, SMS. So this has organizational implications, which I will share later. Nonetheless, they use it for searching for information websites. Those most of the things that are below the red ones, the top 4, would need would need you to have a smartphone, and a smartphone that is connected to the internet, like sending exchanging work related videos via instant messaging apps with doctors. Very rare, but it happens. A typical example here is during the operation room. Sometimes they take a video of the procedure, even with sometimes with the consent of the patient, and they use that video as a learning material among themselves. They share it among their colleagues, and they use it as a learning material for others to actually see. So they record that video. It rarely happens, but it happens. So there are lots of different ways. So imagine I have 18 items there. There are 18 unique ways of using your smartphone for work purposes. Okay? So based on my research, to actually answer research question 1 and research question 2, nurses' use of smartphones is predicted. You can just focus on the red arrows. The red arrows are the ones that are significant. I use structural equation modeling to actually test the framework. So it is a multivariate analysis. So for instance, nurses' use of smartphone is a direct predictor of intention to use. So if you intend to use it, more likely you will use it. And your intention is formed not because of your attitude. So surprisingly, attitude was not really an important factor. So nurses' attitude can range from is it useful to not useful, or is it ethical or unethical to use it. At the end of the day, it doesn't matter how they feel, what's their attitude about it. But what's more important is that if their colleagues expect them to use it, that is injunctive norm. If there's an expectation to actually use it for work, imagine a doctor asks you to send him a text message about the patient status, then you will actually use your own smartphone. Next, descriptive norm refers to whether the behavior is actually something that you can observe among the people around you. So if your fellow nurses use it, doctors use it, basically almost everyone in the clinical work use it, you're more likely to have the intention to use it. And well, people know how to use their smartphones. We have the control to actually use it. So if you feel that you're able to use it, you're more likely to actually use it. So you have more intention. But nonetheless, we see that organizational support has a huge role to play. So it actually affects the attitude of the person. So for example, if an organization actually supports your use, they allow it. So for example, some hospitals actually allow their nurses to use their own smartphone. You'll have a more positive attitude towards it, and you might feel that it's somewhat of an expectation, and you're more likely to perceive that everyone is using it, and you might feel more control of performing that behavior in that environment. So what is interesting with the study is that I also found a positive relationship in terms of perceptions of work productivity and quality of care. The limitation is that when I measured work productivity, it's not the actual. There's no way to actually get actual work productivity data. So these are all perceptions. So at least there's some evidence that when they use it, they feel that they have much more higher work productivity, and they think that they can give a much better quality of care to patients. So what's interesting here is that if you can see the yellow path, there's an indirect relationship between perceived organizational support and use. So here's the mechanism. Once an organization actually supports the use of smartphones for nurses, it actually makes nurses feel that it is somewhat expected to use it. And that increases the intention, and translate to use of the smartphone. Next, when an organization supports it, the more nurses would feel that they have a control over this behavior because the organization basically supports that such action, and that leads to much higher willingness to use it and actually translate to use. So these are some of the mechanisms that actually occur. So it's not only direct relationship, but perceived organizational support actually affects the use of smartphone for work purposes indirectly through through this stats. So that's mechanism. So moving forward, I did collect survey data from 19 hospitals. So the next portion of my study was to actually find out what are the organizational issues of smartphones for work purposes. And I did conduct focus groups among nurse administrators in 9 out of the 19 hospitals. So the figure that you're seeing right now are the way that I actually selected those hospitals randomly. So there's some hospital. So basically they're quadrants 1, 2, 3, 4. So it ranges from how many staff nurses are provided with a unit phone by the hospital and the perceived organizational support on the use of their own smartphone. So basically, the question that I want to ask here is, first, what are the organizational issues related to nurses' use of smartphones for work purposes? The first theme that I found is that there are several issues that encourage nurse administrators to support nurses' use of smartphone for work purposes. So remember, these results were derived from nurse administrators. So I asked them about their staff nurses' use of smartphones. By the way, the survey was conducted among staff nurses. So this result is based on an administrator's point of view. So what are some of the issues that makes them like nurse administrators allow the use of smartphones for work purposes? Now, if there are any problems with existing workplace technologies like landline telephones not working. Wow, I mean, if you visit hospitals, you will be surprised that there's some hospitals wherein their landlines doesn't work. Next, intercom system. It's a very slow machine, like paging Dr. X, please come to this office. So sometimes doctors don't actually hear them. So nurses actually just call them directly with their mobile phones. And so for nurse administrators, the intercom system is a slow way to actually call the doctor. So they allow their staff to actually use their own smartphones to just call the doctor directly. Next, there's some hospitals that they have an instant messaging software in their computer, but eventually they find it very inefficient because the doctors couldn't reply on the software. They can only send messages, but the doctors couldn't reply. So there's an ineffective feedback loop. They can only send messages, but they such message. Next is that although some hospitals actually provide mobile phones, they're somewhat insufficient. So I found that probably for 3 nurses working, there should be at least 1 mobile phone. So if you're going to provide a mobile phone, make sure that the ratio is at least 1:3. So if you have 6 nurses on the spot, there should be at least 2 mobile phones. That's something that they actually shared with me. But the problem is that the hospital management couldn't even afford giving 1 or 2. If you give 1, it's somewhat, it's okay, but still insufficient. Next is that even if you give smart mobile phones, sometimes nurses need to shell out their own money because there's an insufficient unit phone credits, technically load or top up. So a mobile phone becomes useless if they couldn't even use it to actually call the doctor or send a message because it doesn't have any credits at all. So there's some hospitals that actually had problems with this. So nurses shared this. So once they actually have this problem, they allow nurses to use their own mobile phone. Next is unrealistic policies. There's some hospitals that say no mobile phones allowed, but they don't give alternative, like landlines not working, intercom system not efficient. So it's a bit difficult to actually perform a blanket ban of smartphone use because basically it's unrealistic. So nurse administrators actually make exemptions to it. And for some, they actually adjust the policy. They adjust it by saying it's only banned for non-work purposes. For example, using it to browse Facebook, Instagram. I think one of the things that they shared is that some nurses, back then, nurses actually sleep during night shift. So they sleep. I mean, that's a problem for nurse administrators. They sleep. Now, they don't sleep, but they use social media. But they're still inattentive to work. So that's something that they're really concerned about. But nonetheless, they adjust the policies based on how it benefits them. Finally, there's also some issues that inhibited support. So when this happens, they're more likely to advise their nurses not to use their smartphones, even for work purposes. First, some nurse administrators feel frustration and unprofessionalism. So especially when nurses use it for non-work purposes. So when they know that this nurse use it for non-work purposes, they often um, don't allow that person to actually use it for work purposes because they know that this person has some tendency to abuse that kind of favor. And there's some negative outcomes that they feel that they're becoming distracted or inattentive to work. So those are some negative outcomes. And to some extent, there's some hospitals that actually they actually advise nurses not to use it. So verbal reprimand. To some extent, there's some that actually they caught it playing mobile games at work and they actually confiscate it, set fines. Like, for example, you need to pay 100 peso just to get your phone at the end of the shift. There's one hospital that actually does that. And to some extent, lead to some suspension at work. There hasn't been any termination that I've heard of, but the worst case that I've heard of is work suspension for about a week. So even though you wanted to use it for work purposes, but if you use it for non-work purposes, then that's a bit something that is that would inhibit support. Next is misinterpretation of patients. For patients, if they see the nurse using their phone, the automatic interpretation is that they're just using it for their own work, for their own personal reasons. But what if the nurse is using it for to send a text message to the doctor? But well, patients actually see that as when you use your mobile phone, the translation is that you're not taking care of me, you're focused on the phone. So my interpretation is that you're disregarding me. So some nurse administrators advise not, as much as possible, if there are patients around, even their relatives, please don't use that phone in front of them. So you might need to discreetly use it on the side, something that you wouldn't be seen or observed by a relative. So that's some of the advice that they show. So last portion is just a brief rundown of some of the policy suggestions. Now, what hospitals, at least in developing countries, can do is to actually improve existing technologies to reduce smartphone usage. So as you can see, most nurses actually use it for calls and text messages. What if the hospitals make their landlines functional by using a cordless phone? That's one step. And if they have budget, they can actually purchase even a feature phone or a dumb phone. If they have a good budget, they can actually purchase a smartphone. So they can improve their technologies gradually. Next, if they have a desktop computer, maybe we can connect that to the internet so that we can use it for information seeking, so that nurses wouldn't have to use their own smartphones for work purposes. The point here is that they're just using their smartphones because they have no option to use any other device. So if you provide them with some technologies that would reduce their use, then that would be a welcome intervention. Next, provide adequate unit phones and credits. So 1:3, not a rule of thumb, but somewhat of a recommendation based on my research. And it's good to have a multi-SIM card mobile phone. So there are some mobile phones that you can insert 2 or 3 SIM cards. So it's good to have multiple lines of different companies because some doctors would have Globe, some doctors would have Smart, some doctors would have Sun Cellular. So it's good to have multiple SIM cards in one mobile phone. Problem is you need to provide credits for each of those mobile networks. In the Philippines, the payment for such service is different per telecom network. So that is something of a consideration for the management. Next, implement realistic policies. A policy that is like no smartphones at all. It's not something that would work. What I often suggest to hospitals is they actually create a list of do's and don'ts. So for instance, they can use it for text and call, but they're not able to use it for taking pictures. So you can actually specify that. So you need to do a list of what are the do's and don'ts. It's so just saying a policy saying, oh, no smartphones allowed is not something, it's a bit vague. So you need to actually make a list of do's and don'ts. So you can work this out with your nurses, your staff nurses. What are some of the agreed things that you can use their own smartphones? So what are the do's and don'ts? Lastly, you need to actually educate your nurses on the implications of using smartphones at work. You need to still remind them about the policy, privacy and confidentiality laws that are in effect in their work. The Philippines now has started to implement the PDPA, the Data Protection Act, the Philippine Data Protection Act. So that covers nurses' work when they use their smartphones for work purposes. So that is something that needs to be taught to nurses about. They can use it, but they need to be mindful of some privacy and confidentiality concerns when they use their smartphones. And to some certain extent, the courtesy of using it. Like avoid using it in front of patients, do not disregard patients. We have a good, we have this unique terminology in mobile communication research that we call phubbing, P-H-U-B, P-H-U-B-B-I-N-G. It basically means using your smartphone as a means to snub a person. So phone and snubbing. They combine the word phone and snubbing, phubbing. So it can be intentional or unintentional. Basically, there's some people that actually look at their phone even though they're just using it randomly just to avoid contact with another person. So nurses can be accused of phubbing when they actually use it, even for work purposes. They try to snub the patients. They don't do it intentionally, but patients can feel that they are being phubbed. So because the nurses are using their phones and they think that they're being snubbed because out of it. So to summarize, nurses use them for communication, information, and documentation purposes. Nursing hospitals wouldn't do much about it if they don't provide the necessary technologies. And why did they use it? They think that it's something that would improve their work and the quality of care given to patients. There are several organizational issues that would facilitate support for the use of smartphones for work process. And lastly, hospitals need to take a look again of their mobile phone use policies or their bring your own device policies, because this is a natural impact of IT consumerization in the workplace, and it's a reality that healthcare organizations need to deal with this situation, and they need to review some of their mobile device use policies at work. Okay, so that's about it. Thank you very much for listening to this presentation. For any concerns, you can actually send me an email, and I list some of the references wherein I actually derive my presentation from. Thank you very much.
Wow.
We can
Maraming
win
salamat,
any
Dr.
questions.
Bautista. Okay, before
Thank
we
you very
get
much.
into some questions, I would like to introduce our colleagues here from the Philippines. We got Clifford. Clifford, can you give a short introduction about yourself, please?
Hi. Can you hear me?
Yes, we
Yes,
can
can
hear
hear
you.
you.
Yeah. Good morning, everyone. I'm sorry. First of all, I'm late. I thought that it's 10 o'clock, and I realized it was Sydney, and I checked. It is supposed to be 8 o'clock here in the Philippines, so that's why I was kind of a bit late. So anyway, I am Clifford Kilat. First of all, thank you, Sir Jerome, for inviting me in this webinar. It's my first time actually.
Okay.
I am working in St. Paul University, Dumaguete, and I graduated recently in PhD in Silliman University.
Congratulations.
Thank
Congratulations,
you.
Clifford. Okay, thank you very much. And then we also have in this webinar is Johnny Yao. Johnny?
Hello. Hello.
Yes, Johnny.
Can hear you.
Hello. Yes. Good morning. So actually, I'm also a bit late. So I guess technical issues. Anyway, I'm from Cebu City, Veles College. I'm connected with the College of Nursing as well as the research office, and currently the director for research and ethics committee at Veles College.
All right, thank you very much, Johnny. And
Just a question. Veles College is connected with the Cebu Doctors Hospital.
No. Cebu Institute of Medicine.
Yeah. I've been to Cebu Institute of Medicine. I've been there.
okay.
It's a sister school.
I heard that the College of Nursing is the Veles College.
College.
All right.
Yes.
Thank you. Okay, we'll get to know more of you later, Johnny. Why not we get Myla? Myla, like to introduce yourself, please.
Technology issues, I couldn't get my video in place, but I'm a registered nurse in the Philippines, but now currently in Australia. I work at Prince of Wales Hospital, and looking into nurse education, clinical nurse education as a career, hopefully very soon. Thank you. Welcome, everyone.
Thank you.
Thank
All
you.
right.
Thank you.
Thank you, guys. All right. Yeah, we got heaps of important issues that Dr. Bautista was raised during his presentation, and at least from my own point of view, I look at the commercial opportunities that can be derived from the studies. There are practical opportunities as well, opportunities for scaling up of this study, not only in the Philippines but elsewhere. Okay, and there's also a regulatory challenge on the part of the government, and I wish that this research study can be further disseminated. I would like to look at this opportunity for presentation in the Philippine Nurses Association National Convention, or probably in another nursing organization conventions in the Philippines in the future. Okay, but shortly after this, we will upload this material, so for wider reach of intended audience. Okay. Do you have any questions from our colleagues here? Irene?
Oh, yes. I just want to say thank you very much for your presentation, Robert. I think that was really awesome. And for me, my perspective is coming from the Australian context where, I'm listening to your results, and there are a lot of situations that prompt nurses to need to use phones. For example, the information technology that we have in hospitals, we have the phones that work. We have the desktop computers. And I think much of what we do here in Australia mainly delves around the fact that, we have unrealistic policies that say don't use smartphones. But in all honesty, majority of my colleagues, including myself, we use smartphones. For example, I'm a hand hygiene auditor, and I prefer using my smartphone to audit people. And it's not necessarily fubbing, it's I'm actually doing it for work purposes. So I think it's also, your research is highlighting that we need to look at these policies again to integrate it appropriately, educate our nurses, including here in Australia, that we have a big social media policy. We do have this disciplinary action should they start taking photographs of patients. But we have to be realistic and use technology when it's a good thing to do. So I think, yeah, it's really awesome. I think
I
it's really
think
good.
something of trivia is that the idea of the unrealistic policy comes from a literature that I found in Australia. So in
Yeah.
the US, at least they actually do the do's and don'ts.
Well, here I think we've been burnt a lot of times. Like in Sydney itself, in one of the private hospitals, it's been placed on the media, in fact, that one nurse took a photograph of a woman's genitalia and posted it on social media, and she worked in the operating room. And then we also got scared that patients are recording conversations that go on. So there's a lot of fear that's involved, and more fear rather than, hey, this is the practicality of how we can use smartphones. I mean, wound management is a great thing because in my facility, for example, we do have an iPad that is exclusively used to take photographs of wounds, and that's a good thing, and that's covered. So it's just being smarter about how we use this type of technology.
Yeah, so that is a greater implication for IT consumerization, wherein um, administrators really need to work with the employees to actually negotiate how their personal devices can fit into the work that they're doing, fit in terms of regulatory fit and the fit within the hospital, within the practices within that organization. So basically, what I'm telling, at least for some hospitals in the Philippines, if you couldn't provide the technology, don't force nurses not to use their device because it's counterproductive. You just basically kill the communication pathways.
And it's about them. They're finding a solution, isn't it?
Yeah, I mean the nurses are using it as a way to overcome obstacles, and sometimes the management would present itself as the obstacle in that kind of solution. So that's why I'm disseminating this research for some hospitals in the Philippines to actually have encourage the administrators and the staff nurses to actually have a dialogue on how to actually work around these things, and not only the nursing department but also the clinical and the non-clinical departments, because I mean at the end of the day this might spill over not to nurses but the whole healthcare professionals that are within the hospital facility.
All right.
Yeah. So thank you again.
Thanks, Johnny.
Welcome, thank you very much.
Clifford, Johnny, you have questions, Myla? Please.
Yes.
Yeah.
Hello.
Okay, Sir Johnny.
Johnny?
Hello.
Yeah, Johnny.
Yes. Thank you again, Dr. Bautista, for your presentation. Actually, it's quite relevant nowadays, especially for the newer generation of healthcare workers, that they would actually be using smartphones. And there might be a disconnect with the policies that were formulated like way before smartphones were even there. So that's why there might be some, I guess, dissatisfaction with some nurses if they would be implementing those policies regarding prohibition of using of smartphones, because actually in reality the nurses are actually using the smartphones, although by policy it's prohibited. So actually in our hospital we had an undergrad research related to using smartphones, and we actually asked if the policy, what were the policies. So one of the policy was smartphones or phones are not allowed to be used, and but actually in practice they're using it because just like what you've mentioned in your research, it's actually useful for communicate, not only for communication, but considering it's a smartphone, so of course we can gather information there um, uh, to enhance our care for our patient, and even in our assessment we take pictures, but of course there are also issues with privacy. considering now in the Philippines, there's the recently enacted law, Data Privacy Act. So there are also some issues with privacy, with sharing of information. So that's one very big issue, because there's a disconnect with the actual practice and the usefulness of smartphones with the policies that are existing with in the hospitals. And I think it's also cultural, just like what you've mentioned. Some patients, or actually most patients, would think negatively if the nurses would actually be using their smartphones. One question, Doc. I'm curious if there are studies that would actually link the use of smartphones to actual improvement of outcomes, patient outcomes, so that we could really tell the policymakers that using smartphones appropriately would actually improve patient outcomes.
Okay, to tell you honestly, there's no research for that. That is a future aim that I want to actually do. So the outcome that I have are perceptions of nurses, but how does the use of a mobile phone, like a smartphone, like let's say a specific use translates to patient mortality?
Mm-hmm.
I propose that in my research, like medication error as an outcome, but there's no way that hospitals will actually give me that data for an outsider.
Yeah, yeah.
So for me to test that, I need to be affiliated, let's say as a faculty. So if you're doing research in if you have a very strong affiliation with the hospital, what I can suggest is you ask nurses the extent of how much they use their smartphones for each of the use. So I have my list of, you can use my research work to take the list of how nurses use it for communication, information seeking purposes. Then try to get records of, to the extent, like you can ask the nursing supervisor of that nurse. You can ask the rating of the quality of work based on the supervisor as an independent measure of work outcome. Next is you can also get independent measures of medication errors committed by that nurse and try to see some, well, some relationship. An outcome also is that you can also like measure like
11 o'clock.
I think one interesting measure is, well, it's quite difficult to measure mortality because you would really need some serious medical records. So doing that research is something of an administrative obstacle because of access to data. So most of the literature that you would find in this topic are, first, they're theoretical. They just descriptively say how they use, but they don't really say the outcome. So my research is one of the first to give um, a much more robust outcome, but still it's a long way to actually see the relationship in terms of objective outcomes.
I think even, Robert, something along the lines of recognizing and responding to clinical deterioration where you need to make a call. The smartphone, would that be a potential outcome? Or medication error or looking up meds, something of that sort would be interesting.
Yeah. So the problem in the Philippines is records keeping. So even if you want to ask that data, even they allow you, you might not even get a good record. And the problem with medication errors, you need to increase your sample size because it's not that often that happens or gets recorded for one nurse. So most of this would just commit like just one. You wouldn't see someone commit like 10 in a row. You wouldn't find someone that commits that because most likely they've been terminated from work.
Yes.
So it's also like the sampling issues involved with it.
All right. Thank you very much. Okay. We got Clifford. Clifford here for his question. Clifford, please.
Oops.
Um,
Yeah, I think he got disconnected.
I'd like to share if that's okay.
Yep, sure.
Hi, Dr. Bautista. I'd like to congratulate you on your achievement in doing this study. I know how the rigors that you've gone through penetrating all hospitals, asking permission and getting all this data that you need in this study. And then thank you for sharing with us that the results, and that's very like giving us a greater perspective on how the use of smartphones impact on delivery of healthcare, and also on the nurses, part of a healthcare team as a whole. I'd like to share, when I start practicing here in Australia, we have very strict rules in confidentiality and in regards to patients' information, especially with the use of smartphones. But when I had my placement not in New South Wales, but in Melbourne, in one of the hospitals, they have they have a designated smartphone for the unit, which is allocated only to take photos, just like what Irene said earlier, with the wounds, so wound management. So they have this designated phone that would allow them to take photos of like how the progress of wound healing every day, but they have in place, they have consents for them to be able to do that to a patient. But in my workplace, as per observations, we don't have that. But the doctors, like when we run the vascular clinics and they want to monitor the progress of wound healing as well, it's the doctors that are taking photos and save it on their own and the computer for the hospital, and then they go back to it every time they see the patient on a weekly basis, or depending on how often they would need to see the patients. And I also want to share one important observation. This time it's not the nurses that uses the phone. There are patients, a number of them, that come to us who use their smartphones to document their own symptoms. Like they will show this to the doctor when we ask them when did it start, and then, oh, that was like 5 days ago, and I'll show you some photos and this is what it was. And then 2 days after, how did it look? And then from then on, it gives the team a perspective of how has it been in the past few days, that on those days that they were not seen by the doctors. So smartphones also help in that manner. I find it very helpful as well when you need to assess patients and all that. But yeah, we have stricter and more stringent policies in terms of the use of smartphones. And that's all. Thank you very much.
Thank you very much, Myla. Okay, Clifford,
for the
there's a question, please.
Yep.
No question.
Hello.
Yes.
Yes, sir. I'm sorry, I lost my connection. I transferred to my phone actually. Yeah.
Okay.
Well, I think the study of Dr. Bautista is really an evidence-based, especially in our setting here in the Philippines. It's really true and it is existing. Yeah. Probably it's not so much of a question, I guess, but I appreciate the recommendations. However, this could be a challenge especially for our developing countries. For example, the first recommendations in improving our technologies. While our country is really trying to embrace now the fourth industrial revolutions that we have, I think one big challenge is this improving technologies in our settings, because in reality, our healthcare setting is really on difficulty, even on providing some medical supplies. For example, masks for our nurses, gloves for our nurses, and how much more with the medications that we have. So this is actually in connection to the recommendations. Probably it's not only on the managers, but I think it requires a system approach wherein the use of cell phones are actually not only recognized by the nurse manager, but the whole system, including patients, because that is a challenge. Right now, actually, in reality, sometimes our patients are quite having an advanced knowledge than nurses due to the fact that they are exploring it on internet, while sometimes nurses are quite surprised as to what are the terms given by these patients. Honestly, the use of these smartphones for me is really advantageous. In fact, in my duty with my students, since I have observed it when doctors are also using their smartphones in the area, so I allowed my students to use in a discreet manner, like I bring them in a particular area where there are no patients, so that of course the purpose of information seeking there is actually appreciated by the students. So I guess that would be quite concern and a challenge for me on this, especially in these applications of information technology in our country. Yeah, I guess that would be all, sir.
All
Yeah,
right.
I think in terms of the policy, yeah. So I think one of the interesting is that the policies that most staff nurses, so staff nurses now are mostly millennials. The policies were set up by baby boomers. So these are a manifestation of generational gap. So that's one also interesting insight there. So in literature, it's really common to see a disconnect between practice and policy, because sometimes the people who are doing the practice are of a different generation as compared to those who develop the policy. So there needs to be dialogue to actually make the policy a bit more responsive to what is currently happening in the practice. So that's something that is an insight that I got through my study eventually.
All right. Okay. Thank you very much. Much that you would like to entertain more questions at this stage, but yeah, we will continue our conversation. Do not leave the meeting room yet. We don't have much time at this stage. Can we get a final word from Robert?
Yeah, thank you very much for inviting me for this inaugural webinar series. Don't please, if you have any questions, whether about my research or research methods, or basically doing research methods, you need advice on statistical analysis, just to how I communicate this with some nursing departments in hospitals, you're free to email me and drop me a message. So I'll reply as soon as I can. So that's one way for me to actually help our nurse researchers in the Philippines. If any of your institutions are interested to actually invite me for webinars like this, as long as we establish a good internet connection, I'm welcome to do so. So I've been doing this for the medical St. Luke's. PGH, I go there personally because of internet problems. So I can extend this to educational institutions as long as we can arrange a good internet connection. So you can have your students attend a certain lecture or research session, then me via Skype, then that's it. We can actually do those kind of arrangements.
Thank you very much, Robert. Can we have a final word from Irene?
Yeah, thank you so much. It's this is a great inaugural presentation. You've set the precedent, so we're looking forward to the other ones. But I think this is a great way to show that we need to be updated not only with technology but also in research methods. So, as a budding future PhD student, I'm inspired, and I really thank you for taking the time on this Saturday to do this presentation.
All right. Maraming
Thank you very much. My honor.
Okay. Thank you for joining us in the first inaugural webinar series of the Filipino Nursing Diaspora Network. Please don't leave the meeting room yet. We still continue our conversation. Thank you, everyone. Have a good day.